Welcome to today's video about signs of pulmonary hypertension. Your heart beats over 100,000 times every day. But what happens when this tireless organ starts sending you subtle distress signals? Today, we're uncovering 10 hidden warning signs of pulmonary hypertension, a condition that silently strains your heart and can be life-threatening if left undetected. These symptoms are so deceptive that millions of people dismiss them as normal aging, stress, or being out of shape. Before we dive into these life-saving warning signs, if you're new to our channel, welcome to our health community. We're on a mission to make medical knowledge accessible to everyone. Don't forget to hit that like button and subscribe so you never miss content that could genuinely save your life. Your journey to better health starts here, and we're honored to be part of it. Let us know where you're watching from by dropping your country in the comments. We love connecting with our global community. Researchers estimate that pulmonary hypertension may affect 1 in 100 people worldwide, meaning 50 million to 70 million people are living with this condition according to Cleveland Clinic data. Around the world, about 1 in 10 adults over age 65 have pulmonary hypertension, and researchers believe the number of people diagnosed will rise in the next few decades. Pulmonary hypertension occurs when the blood vessels in your lungs become narrow, blocked, or destroyed, forcing your heart to work overtime to pump blood through these compromised pathways. Historical data from the NIH registry shows that without treatment, the median survival was only 2.8 years, with survival rates of 68%, 48%, and 34% at 1, 3, and 5 years respectively. However, with modern treatments and early detection, patients can live significantly longer lives. The tragedy is that this condition often goes undiagnosed for years because its symptoms masquerade as everyday complaints. Early detection can be the difference between life and death. All right, here's the list of pulmonary hypertension signs, starting with the first one. Shortness of breath. The first symptom of pulmonary hypertension is shortness of breath during your daily activities, including climbing stairs or grocery shopping. Research shows that nearly all patients with pulmonary hypertension experience dyspnea by the time of diagnosis, making it the hallmark symptom. Initially, you might notice breathlessness only during moderate effort activities. Many people attribute this to being out of shape or getting older. However, studies demonstrate that in pulmonary hypertension, this breathlessness follows a progressive pattern. What starts as mild exertional dyspnea gradually worsens until patients experience shortness of breath, even during minimal activities. The mechanism behind this symptom relates directly to elevated pressure in your pulmonary arteries. When these vessels become constricted, your lungs cannot efficiently exchange oxygen and carbon dioxide. Your heart compensates by working harder, but as the condition progresses, even this compensation becomes insufficient. As pulmonary hypertension progresses, you'll feel shortness of breath even when you're not moving around. Patients often describe this breathlessness as feeling like they're breathing through a straw. Any unexplained progressive shortness of breath that limits daily activities warrants immediate medical evaluation. Next, sign 2. Unexplained fatigue or weakness. Fatigue is reported in more than half of people with pulmonary hypertension, yet it remains one of the most under-recognized symptoms. Research demonstrates severity levels similar to those in rheumatological and oncological conditions, making this profoundly debilitating. This isn't normal tiredness after a long day, it's profound exhaustion that doesn't improve with rest and seems disproportionate to your activities. Studies reveal this fatigue stems from your body's inability to deliver adequate oxygen to tissues and organs. When your right heart ventricle struggles against elevated pulmonary pressure, It cannot pump enough blood to meet your body's oxygen demands. Research using the multidimensional fatigue inventory found that patients experience general fatigue, physical fatigue, reduced activity levels, reduced motivation, and mental fatigue. This multifaceted exhaustion significantly impacts employment, relationships, and overall life satisfaction. What makes this symptom particularly insidious is its gradual onset. Patients often adapt their lifestyle slowly, reducing activities and attributing their exhaustion to stress or aging. They might start taking elevators instead of stairs, avoiding physical activities, or needing frequent rest breaks during simple tasks. Next, sign 3. Chest pain or pressure. Pulmonary hypertension is an underdiagnosed cause for chest pain in patients without significant coronary artery disease. This chest pain has unique characteristics that distinguish it from typical heart attack symptoms, yet it's often misunderstood. Studies describe it as deep, aching pressure or tightness in the chest that may worsen with physical exertion. Unlike coronary artery disease, which typically causes pain during specific activities and resolves with rest, pulmonary hypertensive chest pain can occur even at rest and may persist for longer periods. Increased pressure in the heart makes the heart's muscles work harder than they should. Increased blood pressure in the heart and arteries may cause chest pain or pressure. An overworked heart may also cause unusual chest pain or chest pressure. The mechanism involves enlarged pulmonary arteries and overworked right heart. Research explains that pulmonary artery enlargement can sometimes compress surrounding structures, including the left main coronary artery. Additionally, enlarged pulmonary arteries share nerve pathways with coronary arteries, causing similar pain sensations even when coronary arteries are healthy. Next, sign 4. Palpitations or rapid heartbeat. Your heart racing or skipping beats could be another hidden cry for help. Palpitations represent your heart's struggle against increased resistance in your pulmonary circulation. When pulmonary pressure rises, your right ventricle must generate more force to push blood through constricted vessels in your lungs. This increased workload can trigger various arrhythmias, including atrial fibrillation, atrial flutter, and ventricular arrhythmias. The overworked heart muscle becomes irritable, leading to abnormal electrical activity that patients feel as palpitations. These palpitations often worsen with physical activity or emotional stress. Patients describe feeling their heart pounding out of their chest or experiencing irregular, forceful heartbeats that can be frightening. Rhythm disturbances create a vicious cycle. Arrhythmias can further compromise the heart's ability to pump effectively, worsening pulmonary hypertension symptoms. Studies show that patients with pulmonary hypertension who develop atrial fibrillation have worse outcomes and increased mortality risk. Next, sign 5. Dizziness or fainting. Perhaps one of the most alarming yet misunderstood signs is dizziness or fainting spells, medically termed syncope. Research shows that syncope represents a critical warning sign of advanced disease or acute decompensation. The mechanism behind these episodes relates directly to your heart's inability to maintain adequate blood flow to your brain. When pulmonary pressure becomes severely elevated, your right heart cannot pump enough blood through your lungs to maintain normal circulation. Syncope in pulmonary arterial hypertension is an independent predictor of poor prognosis in adults. During physical exertion or emotional stress, the demand for increased cardiac output cannot be met, leading to sudden drops in blood pressure and brain perfusion. Patients often experience warning signs before fainting, including lightheadedness, visual changes, nausea, or a feeling of impending doom. Some report feeling like they're graying out or experiencing tunnel vision before losing consciousness. The presence of syncope in someone with suspected or known pulmonary hypertension is considered a medical emergency, requiring immediate evaluation and often hospitalization. Next, sign 6. Swelling in ankles, legs, or abdomen. Swelling in your ankles, legs, or abdomen represents the development of right-sided heart failure, a serious complication that significantly impacts prognosis and quality of life. When your right heart ventricle struggles against elevated pulmonary pressure for extended periods, it begins to fail. When cardiac conditions cause edema, it's due to the development of left or right ventricular dysfunction. When pulmonary diseases initiate edema formation, it's a result of right ventricular dysfunction. The pattern of swelling in pulmonary hypertension is progressive, typically starting in the feet and ankles, particularly noticeable at the end of the day. Patients often report that their shoes feel tight or that socks leave indentations on their legs. Research identifies an association between bilateral leg edema and pulmonary hypertension, with many subjects having no evidence of cardiac or pulmonary disease. As the condition worsens, swelling progresses up the legs and may involve the abdomen, causing abdominal distension and discomfort. The fluid retention can become severe enough to cause significant weight gain, sometimes 5 to 10 pounds or more in a short period, representing your body's inability to maintain normal fluid balance due to heart failure. Next, sign 7. Bluish skin or lips. Bluish color on your skin or lips represents one of the most visually striking yet often overlooked signs. Medically known as cyanosis, this discoloration indicates inadequate oxygenation of blood, showing that your lungs are not effectively transferring oxygen into your bloodstream. In pulmonary hypertension, elevated pressure and damaged blood vessels in your lungs impair normal oxygen and carbon dioxide exchange. Your blood returns to the left side of your heart with insufficient oxygen, leading to characteristic blue or purple discoloration visible in areas with thin skin. The most noticeable areas for cyanosis are the lips, fingertips, nail beds, and sometimes the tip of the nose or earlobes. This discoloration is often most apparent during physical exertion when oxygen demands increase, but may become visible even at rest as the condition progresses. Central cyanosis, affecting the lips and central areas of the body, suggests that oxygen saturation has dropped to concerning levels, typically below 85 to 90%. This represents a medical emergency requiring immediate intervention. Family members frequently report that their loved one's lips appear purple or blue, particularly during activities or when cold. The presence of cyanosis indicates that your body's organs and tissues are not receiving adequate oxygen. Next, sign 8. Upper abdominal fullness or discomfort. Pain in the upper right side of your abdomen is an often overlooked symptom that can indicate significant heart strain. This symptom results from liver congestion due to right-sided heart failure, representing an advanced stage of pulmonary hypertension. When your right heart fails to pump effectively against elevated pulmonary pressure, blood backs up into the venous system, including the hepatic veins that drain the liver. This venous congestion causes the liver to enlarge and become tender, creating a sensation of fullness, pressure, or pain in the upper right portion of the abdomen. Patients often describe this discomfort as a feeling of fullness, even after eating small amounts, bloating that doesn't resolve, or a persistent ache in the upper abdomen. Some report feeling like their abdomen is stretched, or experiencing pain that worsens when bending over or lying flat. The liver congestion can also affect digestion and appetite. Patients may experience early satiety, feeling full after eating only small amounts of food, nausea, and sometimes vomiting. Next, sign 9. Dry cough or cough with blood. A persistent dry cough, or, more alarmingly, coughing up blood, represents serious warning signs that demand immediate attention. Respiratory symptoms in pulmonary hypertension can range from chronic dry cough to life-threatening hemoptysis. The dry cough associated with pulmonary hypertension has several underlying causes. Enlarged pulmonary arteries can compress nearby bronchi, causing irritation and persistent coughing. Additionally, fluid accumulation in the lungs due to elevated pressures can trigger cough reflexes as your body attempts to clear the airways. More concerning is hemoptysis, coughing up blood, which can occur in certain types of pulmonary hypertension. This bleeding typically results from the rupture of small, fragile blood vessels in the lungs that have been weakened by chronically elevated pressure. The cough in pulmonary hypertension often has characteristic features. Patients report that it's typically worse at night or when lying flat, may be accompanied by shortness of breath, and doesn't respond well to typical cough suppressants. Healthcare providers take any respiratory bleeding seriously because it can indicate advanced disease or acute complications requiring emergency intervention. Next, sign 10. Hoarseness or wheezing. Changes in your voice or new onset wheezing might surprise you as symptoms of heart strain, but they can result from the mechanical effects of enlarged heart structures compressing nearby anatomical structures. Hoarseness in pulmonary hypertension occurs due to Ortner's syndrome. When the left atrium or pulmonary artery becomes significantly enlarged due to elevated pressures, these structures can compress the left recurrent laryngeal nerve. This nerve controls the muscles of the vocal cords, and compression leads to vocal cord paralysis and characteristic hoarseness. The hoarseness associated with Ortner's syndrome typically develops gradually, doesn't improve with voice rest, and isn't associated with upper respiratory infections. Patients often report that their voice sounds breathy, weak, or different from normal. Wheezing in pulmonary hypertension can result from several mechanisms. Enlarged pulmonary arteries can compress bronchi, creating airway obstruction that produces wheezing sounds. Additionally, fluid accumulation in the lungs can cause bronchial irritation and constriction. The wheezing associated with pulmonary hypertension often doesn't respond well to typical bronchodilator medications used for asthma or COPD. Pulmonary hypertension is a master of disguise, presenting itself through 10 seemingly innocent symptoms that could easily be attributed to other causes. From progressive shortness of breath that might start as simple exercise intolerance, to unexplained fatigue that slowly robs you of energy, to dramatic signs like syncope and cyanosis that represent medical emergencies, each symptom represents your heart's cry for help. Early detection of pulmonary hypertension can be life-saving. In the modern era, studies show dramatic improvements in survival rates when patients receive appropriate treatment compared to historical survival rates without treatment. What makes this condition particularly challenging is that these symptoms often develop gradually, allowing people to adapt their lifestyle slowly without recognizing the progressive nature of their limitations. Many patients report being told by healthcare providers that their symptoms are due to aging, deconditioning, or stress before ultimately receiving the correct diagnosis. If you recognize multiple symptoms from today's discussion, especially if they're progressive or limiting your daily activities, don't wait to seek medical evaluation. Ask your healthcare provider specifically about pulmonary hypertension assessment, which may include echocardiography, blood tests, and possibly right heart catheterization for definitive diagnosis. Remember, your heart beats over 100,000 times per day, working tirelessly to keep you alive. When it starts sending distress signals through these subtle symptoms, it's asking for help before it's too late. Don't ignore these warning signs. They could save your life. If this video was helpful, kindly type "helpful" in the comments below. That motivates us to produce more content like this. Your engagement helps us reach more people who might need this life-saving information. Please hit the like button if you found this valuable. Share it with your friends and family who might benefit from knowing these warning signs. And don't forget to subscribe to our channel for more health education content that could make a difference in your life. Thank you for taking the time to learn about these important warning signs. Your health is worth protecting, and knowledge is your first line of defense. Until next time, take care of your heart. It's the only one you have.